I have some time to talk to you guys about some of the patients that I've used Low Dose Naltrexone, and since my talk was mainly about allergies and autoimmune disease and asthma, that's where I've documented most of my patients here. Although I've used it in just about everything you can imagine, and some things that might be hard to imagine. But anyway, we're going to be concentrating on autoimmune disease and allergies and asthma. The first patient that I want to tell you about is a young girl with juvenile rheumatoid arthritis. She was a 13-year-old, and she'd been recently diagnosed. Like most people with rheumatoid arthritis, she just woke up one morning with it. When her doctor diagnosed her with juvenile rheumatoid arthritis, her mother agreed to let her go on prednisone to decrease the pain and inflammation, but she didn't want any of the immunomodulating drugs. She was local to us, so she came to us for help at that point. It's always nice to get people early in the process. So I use Low Dose Naltrexone in my patients, but it's never the only thing that I do. Whenever we're talking about autoimmune disease, like we talked about those triggers earlier today, those triggers are extremely important, and I don't know that I stressed it as much as I would like for you to be aware of it. All of those triggers, lack of sleep, which most of autoimmune disease people have, the stressful life situations, extreme stress, not the normal everyday stress of paying the bills and going to work, but extreme amounts of stress, environmental toxins, dietary factors, all of these things are extremely important when managing a person with autoimmune disease. These factors have been shown in research, just in case I didn't stress it enough, they actually increase opioid production in your body. So stress, lack of sleep, these things that we tend to think are kind of soft factors are actually extremely important. And so with her, we put her on an organic, gluten, whole food diet. I talk to a lot of my patients and I tell them, eat food that's just food. So no additives, preservatives, chemicals, hormones, antibiotics, genetically modified organisms. I tell them if you can't read it, don't eat it. If you don't know what that thing is, if it's not something you recognize as something you can take off your shelf or out of your refrigerator and add to your food, you shouldn't be eating that thing because you don't know what it is. For instance, natural flavorings are often MSG. So you can't trust anything that just says it's natural, so you should know what's in your foods. So we put her on a whole food diet. I start all my patients on supplements, whether they're on a few supplements or a lot of supplements. All of my patients are taking supplements. And we worked with her to get better sleep habits. So this was a young lady who was staying awake late at night, even when her mom put her to bed, and she wasn't sleeping well. So this took a little bit of effort, and we worked with her and got her sleeping better. We started her at 1 milligram of Low Dose Naltrexone, and we increased her to 3. So she increased fairly quickly. She went from 1 to 2 to 3 in a 2-week period. And after 2 weeks, her symptoms were so much improved so quickly. I actually didn't expect her to improve that quickly, but she did. She was so much improved that we actually tapered her off the prednisone. And this young lady has only had flares of pain when she eats poorly, when she doesn't sleep well. She came in to see me once when she'd been on a sleepover and had pizza, and the next day it had ice cream. So she does all this, and she has a flare. 1 year later, she was lost to follow-up to me because she was doing so well that I had spoken to her pediatrician, and that pediatrician agreed to keep her on the Low Dose Naltrexone. And as far as I know, she's still doing well. She hasn't been back, but she was doing remarkably well. And that her pediatrician was willing to prescribe it, I thought was a huge step forward, because as you know, getting doctors to prescribe this can be hard. This was an 8-year-old young woman with ulcerative colitis. A very tragic case, as any ulcerative colitis is, if it's severe enough. And she started out with abdominal pain, chronic bloody diarrhea, recurrent fevers. She was 8 years old. She was almost 4 feet tall, but weighed only 22 pounds. She had recurrent problems with chronic elevations of her inflammatory markers and white blood cells indicating infection. Her doctors had her on multiple medications, and she would, get a little bit better, a little bit worse, but she never got significantly better. She had repeat colonoscopies, and they kept showing worsening disease process. Her doctors had actually talked to her parents about a colectomy, not necessarily right now, but they said, this is in her future. That's when they came to me. So her treatment plan, again, the dietary changes, extremely important, supplements. We also did reflexology on her, which I think really helped her, especially with symptom relief. Now, we don't know what that's doing because we don't have a colonoscopy. I don't have any colonoscopy exams of people getting reflexology for ulcerative colitis. But we've really felt like this helped with her symptoms. And then, of course, she was started on low-dose naltrexone. We started her at a 0.5 milligram dosage. She was increased slowly because she'd had so this is an example of a patient that has a lot of sensitivities, not responding well, very, very sick. So we went up very slowly with her. And she increased by 0.5 milligrams every 2 weeks. And I haven't tried the transdermal yet. I'm actually really excited about that. That's probably one of the reasons I have to go up so slow on my patients with ulcerative colitis. I'm looking forward to trying that. She tolerated the oral okay. We got her up to 1.5. 7 years later, I say, this was not a fast process. Slowly over time, when she came back to see me in 3 months, she was maybe a little bit more stable. At 6 months, it was obvious that she was more stable and not progressing. At a year, she was a lot better. So this was and maybe it was because I had used the oral form on her and she wasn't getting it as much. But this little girl, she took quite a while, but after about a year, she'd had significant improvement. And 7 years later, she's actually still stable. She's fairly, I'll say, symptom-free as long as she sticks with her diet and low-dose naltrexone. And I like to say she has all her pieces and parts with her. She hasn't had to have anything removed. This boy was kind of tragic. He had a very, very severe asthma at 9 years old. He required rescue inhalers 1 to 4 times a day. He had ER visits sometimes as often as twice a week, but usually at least twice a month. Multiple URIs, upper respiratory infections, requiring antibiotics and prednisone use. His parents, they did everything for him. They had removed all the carpets in the house, removed all the drapes in the house. They had covered the beds, used appropriate air purifiers, removed dairy. They had him on supplements. So they were doing everything, and this was still happening to him. So I adjusted his supplements when he came in. He had significant yeast overgrowth with candida on his tongue, so we started him on yeast treatment. On this patient, we did food sensitivity testing and changed his diet. So I put patients on elimination of anything they have a severe sensitivity to. Anything that they have a mild sensitivity to, we rotate it no more than twice a week, 4 days apart, eating that food. He was taught breathing techniques, the Buteyko breathing techniques, if you're familiar with that, and breath holding. Sometimes breath holding can actually help to break an asthma exacerbation. We started him on 0.5 liquid. He just didn't tolerate pills very well. And tapered him up by 0.5 every other week. And then within a month, he was using less of his rescue inhalers. In a month, he hadn't had to go to the ER, which his mom thought was a huge improvement. He was having some days where he didn't even require his albuterol inhaler. And within 3 months, we completely tapered him off of his prednisone, and he was still using one inhaler, but not a rescue inhaler, just a daily inhaler. And he's now been 3 years, and I said here he'd been without an ER visit, but I believe he's actually had to go to the ER twice in that time, both times when he had respiratory infections. So I didn't mean to lie to you here, but he's actually been twice, both times associated with upper respiratory infections. But the respiratory infections, he'd only had 2 in the 3 years, which was extremely significant because he'd been having upper respiratory infections, which is bronchitis, sinusitis. He'd been having these, like I said, several times a year. So 2 in 3 years was highly significant. This is a 46-year-old female that had multiple sclerosis. She's an executive, loves her job, but it's very demanding and very stressful. She had to be taken off of work because of severe brain fog, debilitating fatigue, and she was having frequent relapsing symptoms. Very poor sleep quality, as I see in most of my autoimmune patients, if not all of them. She'd already cleaned up her diet before she came to see me. She was already taking supplements. She'd already been tested and treated for heavy metal toxicity. So we started her on 1.5. I tapered her up to 4.5, which she tolerated quite well. We also started her on, she was menstruating, so we started her on rhythmic progesterone and estriol at 8 milligrams. I don't know if you're familiar with this, but 8 milligrams of estriol has been shown in research to decrease the plaques in the brain of women with multiple sclerosis. So she was put on estriol as well. And then her adrenals were very, very low, practically non-existent. So we started her on Cortef, which is hydrocortisone, at physiologic dosing. This is per Dr. Lee's research and Dr. Holtz. Thank you, Jefferson, right, and Holtorf. There she goes. So within 2 weeks, she was sleeping better. So she didn't have any problems with sleep on the Low Dose Naltrexone. She actually started sleeping better, although that may have been the progesterone, which is notorious for improving sleep, and it may have been from the adrenal gland improvement as well. Her energy levels improved, brain fog cleared. So within a month, she was out. She was walking her dog at the park. She was starting to do some paperwork at home and catching up with some stuff that she'd gotten behind on. Her exacerbations became less frequent and stopped. This was over about a 6 to 8 month period that her exacerbations became less frequent and stopped. And then she's now been back to work for 5 years without any significant exacerbations that have had to that have taken her off of work. Of course, I'm telling you guys all the good patients. This lady was very interesting. She was a 67-year-old woman. She actually, it was her husband that we were treating after a stroke. And she came in just as what we call a companion patient. So she was just there. We were doing her basic blood work, kind of seeing if there was anything we could do to just keep her healthy and strong. She didn't have a lot of concerns. But as I was doing her history and physical exam, she was telling me about her severe allergies. And she'd been waking with postnasal drip, sore throat, voice changes for 30 years now. She had frequent sinus infections, chronic headaches. We started her on low-dose naltrexone at 4.5 milligrams. I didn't taper her up. We just started at 4.5. This was shocking to me, and I believe it's the only time it's ever happened. She actually came into the office the next day and told me that she had woken up with no postnasal drip, no sore throat. Her voice was normal. And she said she'd felt better than she'd felt in years the next day. And that, like I said, was quite shocking to me. I thought, okay, that's probably a placebo, but I didn't tell her that. 7 years later, she still is not having problems with allergies, any of these pre-existing problems that she'd had for decades. She's on her low-dose naltrexone, and she's very, very happy. This woman comes from a part of the country where there's actually a large amount of autoimmune disease because of they're surrounded by factories. And so There's a lot of toxins in their environment. And she's very active, fairly healthy, is a business owner. She actually owns a car repair business. And so another means of getting toxins into her system through the stuff that they're exposed to in their business. And she was having difficulty. Her and her husband run the business together, but he was having to take over more and more of the business responsibilities because she wasn't able to keep doing it due to fatigue, joint pain, and severe deformity in her hands and elbows. And her ankles, while not deformed, were so painful that she was having a hard time getting around. Her doctors had put her on methotrexate and prednisone, but she was still worsening. So they had recommended immunomodulating drugs, and I should say immunosuppressive drugs here just to distinguish it from immunomodulating endorphins, which actually improve the immune system function. So immunomodulating just means that it modulates or changes how the immune system acts. It's not necessarily bad or good. But immunosuppressive drugs is what they had recommended. She didn't want to do that. So that's when she came to me. So again, dietary changes first and foremost, supplements. We actually did a lot for her. So she had acupuncture, microcurrent therapy. She did have heavy metal toxicity in lead, aluminum, and mercury. So she was very toxic in several things. And so she was treated for that. She was started on bioidentical hormones, adrenal and thyroid support as well. Remember that the hormones in the adrenal axis are extremely important in autoimmune and inflammatory conditions. And we started her on Low Dose Naltrexone. Again, I didn't taper her up. She just started directly at 4.5 milligrams. She was with us for 3 weeks. And in 3 weeks, with all the therapies and everything we started her on, she was literally tapered off all of her medications, including prednisone, over that 3-week period. And she went home just on these hormones, thyroid, adrenals, and low-dose naltrexone, and bags of supplements. 7 years later, I just spoke to her on the phone about 2 months ago, and she is still not on any drugs besides the ones that I'm giving her. She still has the deformities in her arms and elbows that she had when she came in. That doesn't go away, but she hasn't gotten any more. She's had no progression, and she has now no pain. So she still has the deformities, but she's not suffering from pain anymore. This was a really interesting case, and it's the only person with eosinophilic esophagitis that I've treated. But she was very tragic. I got her age wrong. She was 26. I'm not sure why I put that there, but she was 26. She'd had to drop out of college because of her severe symptoms. She'd been unable to eat solid food. She had dozens of food sensitivities, just determined by how her body reacted when she ate those foods. So there were so many things that she couldn't eat. She had obviously chronic throat pain. I should explain that eosinophilic esophagitis is unclear what it is or what causes it. Some doctors believe it to be autoimmune. It is absolutely inflammatory, and it's very notoriously difficult to treat. So she'd been tried on multiple medications, but nothing had worked for her. They'd helped to maybe keep it from progressing, but she hadn't gotten any better. And she'd tried multiple supplements before she came in. So on her diet, we tested her for food sensitivities. We put her on a kind of a complicated diet plan. We did allergy elimination from a food sensitivity testing. She did mostly a macrobiotic whole food diet, but we also did some blood type consideration with her. She was a type A, so I took her off of a lot of meat proteins. Of course, supplementation. So I tailored her supplements for her. For her, alpha-lipoic acid and MSM I thought were very important aspects of her treatment program. Orally, alpha-lipoic acid. hyperbaric oxygen. I was dying to ask Dr. Berkson what he thought of the oral alpha-lipoic acid, but I guess I'll have to ask him by email. What I do know about oral alpha-lipoic acid is that it is absorbed extremely well through the gut, as is MSM. So these things you can usually take a high dosage. It doesn't cause, for most people, it doesn't cause any sort of stomach problems or upset. You can take the same dosage by mouth. I do know in my patients when I have very severe disease that we often do put them on the IV alpha-lipoic acid, and it seems to work better, although I'm not clear why. But I put her on oral. She had hyperbaric oxygen, acupuncture, reflexology, frequency-specific microcurrent therapies. You can see we were working hard to get her better. You'll also see that low-dose naltrexone isn't mentioned here. That's because she'd had such adverse reactions to medications that she just didn't want to try it. So she was at our clinic for 4 weeks and had basically no improvement. We'd gotten her to eat, we'd improved how well she could eat, and she'd improved just a little bit, but not a lot. So she finally agreed to try the low-dose naltrexone. I started her on liquid dosing because she was so nervous about it is the main reason we started her so low. I wouldn't normally have done that. But we started her on liquid at 0.1 milligram, and she increased by, I told her she could increase once every 3 to 5 days, but she didn't have any problems, so she increased the next day and the next day and the next day. And when she reached a 3 milligram dosage is about the time that she started feeling a lot better. So then she started increasing by 0.5 every other day. And after 9 months at 4.5, now again, this did not happen quickly. She's from Hawaii, and she'd gone home, so she was just on the low-dose naltrexone supplements and dietary changes. Was her treatment program when she was at home. And we were following up about once a month by phone. And every month she was telling me she's a little bit better, she's able to eat a little bit better, she's gaining weight. After 9 months, when I talked to her on the phone at a 4.5 milligram dosage of low-dose naltrexone, she was symptom-free. And she was actually a little chagrined to be overweight and wanted to know if I could help her to take some of it off. So I was thrilled by that. Her primary care doctor in Hawaii took over her low-dose naltrexone, so I haven't followed up with her. I believe her last follow-up was about 1.5 years after her initial presentation, and she was still stable at that point. This was a 9-year-old patient with ADHD, chronic abdominal pain and headaches. She'd been having the progressively worsening abdominal pain, headaches. She'd been gaining a lot of weight, wasn't doing well in school. Her pediatrician did labs. This was all before she came to me. Her pediatrician did labs that pointed to a liver problem, and biopsy finally confirmed the diagnosis of autoimmune hepatitis. She came to me when she was 11. She'd had multiple relapses, and the disease was progressing despite their medications. She'd had recurrent prednisone, and she was on immunomodulating drugs. She was fatigued, overweight, moody, and had poor dietary habits. So we actually put her on the GAPS diet, gut and psychology syndrome diet. She did very well on this. We did food allergy testing and treated her for those, started her on supplements. We treated her with therapies for 3 weeks. The neurofeedback was for the ADHD aspect of what was going on with her. And she was started on LDN at 0.5 and increased every 2 weeks until she reached 3.5. That was actually a little bit much for her weight. She was about 50 pounds. No, this is a little plump blonde girl. She was actually overweight. That's why I put her on 3.5 milligrams. Sorry, I had to reorient myself here. I've had 2 little girls with autoimmune hepatitis. So she was a little bit overweight, and I put her on 3.5 milligrams. She's had fewer exacerbations. Her exacerbations have been shorter and not as severe, not requiring as much medications and responding better to therapies. That was her first improvement. her liver function tests and are not normal, but they're better. Her ANA elevation, the anti-nuclear antibody that often goes along with this, has been close to normal for 2 years. And she's doing a lot better in school, and her weight's stabilized. She's still taking low dose naltrexone, and she was on Cortef 10 milligrams a day the last time that I spoke to her and her mother, which was 2 years after her presentation to me. And her hepatologist was managing that and had agreed to change her from the high dose, from the prednisone to the Cortef. And on our last visit, we were talking about dosing it down a little bit, but she was lost to follow up to me because she then changed to her hepatologist, if I'm remembering correctly, who took over her low dose naltrexone prescription. This was an unusual case of ulcerative colitis in a 15-year-old with no gastrointestinal symptoms. What had happened is that he'd been in a motor vehicle accident, and he'd hurt his head and his neck, so they'd put him in a collar, taken him to the ER, and in the process of their x-rays, they did blood work. The blood work showed, well, okay, I'll get to that in just a minute. While he didn't have any gastrointestinal symptoms, he was below average height, and he'd been on the high end of the growth curve for his whole life until about 2 years prior to this, when his growth had just kind of evened off a little bit, and he was now below average. There was no reason for that. His pediatrician had checked out everything they knew how to and hadn't found a problem. He did feel fatigued a lot, and he felt like he wasn't doing as well in basketball as he could. And this was a big problem for he and his family because they took the basketball very seriously. So the labs, hemoglobin and hematocrit, that's his red blood cells. So they were low. He was anemic. His white blood cells were a little high, his iron was deficient, and his CRP was high. He was also Hemocult positive. I was surprised to see that they'd done this in the ER. But they did. Later, he was tested as Pianka positive, and on colonoscopy, he had mild disease. Parents refused any medications for it, and he came to us, or he came to me. We put him on immediately gluten and casein-free diet, organic food, that's just food, food allergy testing. He wasn't allergic to very much, just a few things. Tailored his supplements and started him at 1.5 milligrams, increased to 4.5 milligrams over 3 weeks without any problems. He was a model patient. He started responding almost immediately to the low-dose naltrexone. So his anemia resolved. The CRP, the inflammatory marker, normalized. It took about 5 to 6 months for the CRP to normalize. So that one didn't happen immediately, but the anemia resolved almost immediately. On the second month's blood work, the anemia was gone. He started growing again. He's now taller than both of his parents, and his basketball improved so much that he actually got a scholarship to college. He's in his sophomore year at college right now. This is also kind of an interesting case of a 58-year-old woman, postmenopausal. When I say severe, it just does not begin to cover the severity of her symptoms. She had constant, debilitating hot flashes. As you see, the pain, vaginal pain and dryness, so severe that she sometimes hurt to walk. She was waking every 1 to 2 hours with night sweats. And of course, she was moody and fatigued. How could she be anything else? She also had osteoporosis, high blood pressure, dysmetabolic syndrome, which is syndrome X or pre-diabetes, and chronic headaches. Her primary care doctor had started her on Primpro, but her symptoms only worsened on that. That's when she came to me for bioidentical hormones. We actually struggled for 2 years to balance her hormones. I tried everything. We tried everything from a rhythmic approach to the Wiley protocol to standard, constant dosing, very high amounts, low amounts, different times of the day. Nothing seemed to work for her. She would get a little better, but she never got comfortable. That's when we decided to try Low Dose Naltrexone. So at this point in my career, I hadn't been familiar with Low Dose Naltrexone as a way to modulate hormones. I just thought, it increases endorphins, it improves hormones, let's just give this a try. So we did. After we started the Low Dose Naltrexone, her symptoms, I say slowly here, but compared to some of the other patients when I say slowly, it was actually fairly quick. After 3 months or 3 years of torture, is what she called it, finally ended. It has not returned. Her hot flashes abated. She still has them once a day to once a week. No more night sweats. She's sleeping well, sleeping through the night. The vaginal dryness is completely gone, and she's able to have sex again. When I walked into the room and she told me that, she gave me a big hug, and she said, "My husband thanks you so much, and so do I." So she is very happy. And still, now this was several years ago, 7 to 8 years ago. She was one of my very first patients. No, it would have been closer to 5 to 6. And she's still stable, still doing very well, still not having any problems. And I didn't put on here, but I should have. Her other symptoms, the high blood pressure, the headaches, the blood sugar and cholesterol issues, those normalized. Now, that may have been partially because now she's sleeping through the night, which is extremely important for your endocrine system. And that's what creates the dysmetabolism, is in large part your endocrine system. She's able to exercise, which she actually likes. So of course, blood pressure, blood sugar, and cholesterol would come down. So it's not that the Low Dose Naltrexone necessarily did all of that, but as an effect of the Low Dose Naltrexone, she was able to do the other things that helped to get the rest of her disease processes under control. And this is a case that's very near and dear to my heart. It's a 32-year-old female. She had psoriasis, irritable bowel syndrome, chronic fatigue, and began to develop severe joint pain, increasing abdominal pain, and finally a malar rash. It just kind of looks like a butterfly going across your skin, your cheeks and your nose, which is fairly typical for lupus. Testing did confirm that she had systemic lupus. She refused immunosuppressing drugs, treated with supplements and healthy diet, maintained okay but not great until she was in the hospital and contracted MRSA, which MRSA is a multi-resistant bacteria, one of those superbugs that you hear about. So if you remember from my talk earlier today, people that have chronic elevations in these inflammatory cytokines and opioids have suppression of their immune system, so their body can't fight off infections. This is what happened to her. She was treated twice for the MRSA because it came back. Then she actually got septic. Almost died in the hospital, but did live through it. But after she was released from the hospital, the infections kept returning. So they would return as boils, and she would get them, she would take antibiotics, it would go away. A few weeks later, she would get them again. And she was getting progressively sicker and sicker, worsening symptoms, rising ANA, no organ damage as of yet. Unable to take the immunosuppressive drugs because of the recurrent MRSA, which would have made it worse. She was intolerant to the other drugs for lupus. Her doctors basically just said she would die. She's not likely to make it past 40. Her and her husband tried multiple alternative modalities: acupuncture, Ayurvedic medicine, homeopathy, practically everything you could imagine they tried. In my office, she received a lot of treatment. Mercury toxicity was a huge thing for her. She had the highest amount of mercury in her system that I've ever tested in anybody. So we got rid of her mercury toxicity, put her on a healthy diet, treated her for yeast overgrowth. She had an extremely, extremely stressful life. And so she and her husband were sent to counseling. And that can be, this is the only time I really mention psychological stress, but I can't stress enough how important it is to take that into account. Research has actually shown that stress increases, end result, opioid production, which suppresses your immune system and makes you more susceptible to autoimmune diseases, significant life stressors. So that is something that's important to take into account. So she was started on Low Dose Naltrexone 1.5, but she couldn't take it. She had severe insomnia and pruritus. This is the only patient I've ever had with this problem. She itched. So she didn't itch during the day, but at night, this is actually what kept her awake. She would have these itches just randomly. You know, her right shoulder would itch, and then her left knee would itch, and then her head would itch. So, and that kept her awake. It kept waking her up every time she tried to go to sleep. We changed her to the liquid form and did 0.5, but she still couldn't tolerate it. So we tried again. We put her on 0.1 milligrams and increased by 0.1 a week. So an extremely low dose taper up. She went to 1.5, and that's where she is now. She's currently still on all of her healthy stuff, including the low dose naltrexone. Ever since starting, no recurrence of MRSA in 8 years. No signs of symptoms of lupus, normal blood work for 7 years. Intestinal symptoms, IBS, completely resolved. For 2 years now, that took longer. Psoriasis, almost completely gone. And as this reveals, that person was me. Thank you. So you can see why Low Dose Naltrexone is so near and dear to my heart and why I try it in so many people. And I encourage you to do the same. Thank you.